weeks after emergency physicians here at Surrey Memorial Hospital declared it was in crisis. Now the hospital's obstetricians and gynecologists are calling for more funding and resources, saying that patients are at a higher risk of death without it.
10 years ago, the unit was built for 4,000 deliveries per year. We now do 6,000, and the number of beds that has gone up is approximately 4. So that obviously falls short. We're already behind.
In an open letter to Surrey residents, Dr. Stornis Bliss says they need more space, more beds, and more nursing staff to care for patients. The letter goes on to blame the lack of resources for the death of a newborn baby, adding that physicians and staff are physically and emotionally tired from not being able to support patients.
So that means discharging patients early from the hospital, not admitting them at the same time as we would have, letting them labor a little bit before being admitted. And at times these patients have to wait in our triage area for a long time.
Fraser Health says it's working on addressing the shortages that are affecting regional hospitals, as well as meeting Surrey Memorial's growing needs.
I appreciate the frustration when it feels like we can do better work for our patients than the current context is. That change will take time, but it's not going to be without bumps along the way, and I think that's where we're at today.
BC's health minister, when approached by City News, not commenting on the issue, instead deferring to Fraser Health. Critics say that's not enough.
He hasn't said a word since yesterday, since we have learned about the death of an infant, that we have learned about the moral injury of our healthcare workers in our city, about the risk to people in our communities, not just here in Surrey, but across the Lower Mainland and across British Columbia. This minister is failing in his duties, and a change needs to happen ASAP.
Even with the Provincial Health Authority, we see all that money spent in Vancouver. We see it with BC Women's, with Children's, with GF Strong. Those are all Vancouver-based facilities that are actually Provincial Health Authority facilities. Surrey residents don't have that kind of access to care.
Dr. Stornis Bliss hopes residents from Surrey and across the Fraser Health region will give voice to their cause and demand change.
We deserve to get standard, excellent care in Surrey. We deserve to deliver our babies in Surrey.
In Surrey, Sarah Chu, City News.